"Give the blind sniper to the rookie." Dr. Paige Warren said it loudly enough for the nurses stationed to hear. The words were followed by the kind of laughter people used when they wanted cruelty to sound harmless. Dr. Leah Serrano stood at the end of the counter, reviewing the chart of the patient in Trauma 4. She had worked at Chesapeake Naval Medical Center for 11 days. That was long enough for the residents to call her quiet, but not long enough for anyone to ask why she always positioned herself where she could see every exit. Paige tapped the chart with one polished fingernail. Chief Petty Officer Cole Maddox, Navy SEAL sniper, 40 years old, completely blind after a blast injury. Refuses sedation, refuses rehabilitation, and nearly broke a technician's wrist this morning. He grabbed the technician after she touched his face without warning, a nurse said. Paige shrugged. That is still assault. Across the station, a young resident named Tyler Beck angled his phone toward the trauma room. His camera was already open. Dr. Conrad Weller stepped out of the physician workroom, reading from a tablet. He was the emergency director, 56, broad-shouldered and efficient. He had the reputation of a man who could clear a full department before dinner and make every delayed patient feel like a personal failure. "Cole is waiting for psychiatric transfer," Weller said. "Your job is to keep him calm until transport arrives." Leah looked up. "Why psychiatric?" "Post-traumatic aggression, refusal of care, difficulty accepting permanent blindness." "Who determined the blindness was permanent?" "Ophthalmology, neurology, and 2 military consultants." "How long after the explosion did he lose vision?" Weller paused. Paige answered first. "Immediately enough. That is not a time." Weller's expression cooled. 6 hours, according to the transfer note. The blast damaged his visual pathways. The exact hour does not change the outcome. Leah closed the chart. "It might change the diagnosis." Paige smiled toward the residents. "There she goes." Weller ignored the comment. "Keep him stable. Do not challenge him. Do not discuss classified operations, and do not let him dictate the department." Leah walked toward Trauma 4 while the laughter followed her down the corridor. Cole Maddox sat upright on a hospital bed with both feet planted on the floor. His camouflage jacket had been cut away at one shoulder, exposing a bandage beneath. A thin scar crossed his right eyebrow. His eyes were open, pale blue and fixed on nothing. 2 security officers stood near the wall. A nurse held a syringe beside the medication cart. Cole's head moved toward the sound of Leah entering. His hands remained on his thighs, but every muscle in his body looked prepared for impact. The whiteboard behind him read, "Patient blind. Speak loudly." Leah stopped just inside the doorway. "My name is Dr. Leah Serrano. I am 6 feet in front of you, slightly to your left. I will not touch you without telling you first." The room changed. Cole did not relax, but his shoulders dropped by 1 degree. Paige entered behind Leah with Weller and 3 residents. Tyler remained near the doorway, phone low against his chest. Paige raised her voice. "Chief Maddox, Dr. Serrano is new. Try not to frighten her." Cole's jaw tightened. Leah looked at the security officers. "Why are they here?" "He is unpredictable," Paige said. Cole turned his face toward her voice. "You keep saying that like touching a blind man without warning should end well." His voice was rough but controlled. Leah looked at the syringe. "What medication?" "Lorazepam," the nurse answered. "Ordered for agitation." Cole's pulse rose on the monitor. Leah said, "Put it down." Weller frowned. "The order stands if needed. It is making him more agitated before anyone has even given it." Cole's head turned toward Leah again. She stepped closer, announcing each movement. "I am moving to your right side, 3 feet away. I am going to check the monitor, not touch you." His breathing remained fast. Leah watched the numbers. Pulse 124. Blood pressure elevated. Oxygen normal. Not panic alone. Pain lived in the tightness around his mouth. "Where does it hurt?" Cole laughed without humor. "Everywhere they already decided does not matter. Start with the worst. Back of the neck. Right or left?" "Left." "Does it move?" "Up behind the ear." "Any sound with it?" His face changed slightly. Paige looked at Weller as if Leah had asked something ridiculous. Cole answered, "A heartbeat." "In the ear?" "Inside my skull." Leah moved another step. I am going to shine a light toward your eyes. I will not touch your face. Cole's hands tightened on his thighs. They already did that. I know. I am telling you before I do it. She used a small pen light. His pupils constricted. Both of them. Quickly. Leah changed the angle. Cole's eyes shifted toward the brightness, not accurately enough to follow the light, but enough to prove that darkness was not absolute. Can you see that? No. Nothing. A change. What kind? Like someone moving behind a black curtain. Weller spoke from the doorway. Light perception can remain after severe optic injury. Leah did not look away from Cole. Did the darkness begin all at once? No. What happened first? Flashes. Then? Missing pieces. Then black. Cole nodded. How long after the blast? 6 hours. Maybe 7. Weller folded his arms. The record already says that. Leah asked, Were you conscious the entire time? Yes. Did your vision disappear in both eyes together? Cole took a breath. Left side first, then everything. She moved the pen light again. His eyes reacted. The nerves from the eyes to the brain were carrying something. The brain was receiving light. It was not understanding what the light meant. Leah looked toward the nurse. Remove the security officers, Paige said. Absolutely not. Cole's pulse increased again. Leah faced the officers. Stand outside the open door. He will still be visible. Weller considered it, then nodded. The officers left. Cole exhaled. Leah spoke in a slower cadence. Breathe on 4. Hold for 2. Move only on my voice. Cole went perfectly still. The words had not been planned. They came from somewhere older than the hospital. Snow against a radio tower. Rotor blades hidden in cloud. 6 men moving through darkness, while her voice counted the distance between them and the extraction point. Cole's face lifted toward her. Leah felt the past recognize her before he did. Again, she said. Breathe on 4. Hold for 2. Cole inhaled with her count. 1, 2, 3, 4. He held, then released. His right hand rose slowly from his thigh. Everyone in the room tensed. Cole brought 2 fingers to his forehead and gave a precise military salute toward the exact place where Leah stood. Tyler's phone lowered. Paige stopped smiling. Cole's voice became almost a whisper. North Star. Leah's breath caught. No one had called her that in 7 years. North Star had belonged to encrypted radios, night flights, and men who could not see the path home. It had belonged to a different uniform, and a version of Leah who believed every life could be carried out if her voice stayed calm enough. Cole lowered his hand. You disappeared. Weller looked between them. You know this patient? Leah kept her eyes on Cole. He knew my voice. From where? I am not discussing it in front of an unauthorized recording. Every face turned toward Tyler. He pushed the phone into his pocket. I wasn't. Open it. He hesitated. Weller held out his hand. Tyler surrendered the device. The camera had captured Cole's salute. Weller deleted the video and looked at the resident. Leave. Tyler left without speaking. Before we continue, welcome to Emergency Legends Archive. If you enjoy stories about quiet heroes, impossible diagnoses, and the moment an underestimated professional is finally recognized, subscribe, leave a like, and tell us where you are listening from. Paige recovered first. Recognition does not change his medical condition. No, Leah said. His examination does. She moved closer to Cole. I am going to touch your right wrist and test your strength. Do it. Her fingers settled over his pulse, strong, regular, then suddenly uneven. Lift your right arm. He lifted it halfway. Left. Both arms moved. Smile. His mouth pulled evenly. Stick out your tongue. Midline. Weller said, Neurological exam is stable. Cole's hand tightened around Leah's wrist. The dark moves. What does that mean? It rises. From where? The bottom, like water. Leah took the transfer records from Paige. The first brain scan showed no large hemorrhage. The eye examination described intact retinas and reactive pupils. The optic nerves had been labeled possible traumatic injury, but no one had proved destruction. She found the mechanism report. Blast wave, head rotation, impact against the left posterior neck. Was your neck scanned with vascular contrast? She asked. Weller answered, a routine trauma scan was negative. That was not my question. A CT angiogram was not considered necessary. Cole released Leah's wrist and pressed his fingers beneath his left ear. The monitor changed. Pulse 130. His face went pale. Pain worse? Leah asked. Yes. Any nausea? Before he could answer, his body tilted. Leah caught his shoulder and announced the contact even as she made it. My hand is on your back. Stay with my voice. Cole tried to speak. The word came out distorted. Nor. Star. His right arm slid from the bed. Leah lifted it and let go. It dropped heavily. Paige stepped forward. Could be a panic response. Leah looked at Cole's mouth. The right corner had fallen. Cole, show me your teeth. Only the left side moved. Weller's posture changed. How long? Now. Cole's speech worsened. Dark. Climbing. Leah reached for the emergency call button. Activate stroke protocol. Full CT angiography of the head and neck. Call neuro-ophthalmology and interventional neurology. Weller looked at the reactive pupils, the weak arm and the pain at the back of Cole's neck. The prior scan was negative, and the patient is changing in front of us. Cole's eyes remained open, staring into a darkness that had never begun in his eyes. Leah faced Weller. His eyes are not the emergency. His brain is. The stroke alert changed the emergency department before Cole Maddox reached the scanner. Doors opened. Phones rang. A radiology technician cleared the CT table while nurses placed a second IV and attached portable monitors to his stretcher. Leah walked at his left shoulder, announcing every turn before the wheels moved. We are leaving Trauma 4. 10 feet to the main corridor. Right turn in 3, 2, 1. Cole's face remained turned toward her voice. His right arm still lay weaker than the left, and the corner of his mouth had not fully recovered. The darkness gave him nothing else to follow. Doctor. Conrad Weller walked on the opposite side. His strength is already returning. That makes the episode transient. Leah said. Not harmless. Could be a medication effect. He has not received medication. Then stress response. Leah looked at Cole's hand. His fingers twitched against the blanket, as if trying to find a weapon that was no longer there. Stress does not usually weaken one side of the body and distort speech. Weller did not answer. At the CT doors, a technician reached for Cole's shoulder without warning. Cole reacted instantly. His left hand shot up and trapped the technician's wrist before anyone understood what had happened. Security moved forward. Leah raised one hand. Nobody touches him. Cole's grip remained firm. Cole, this is Leah. The technician reached without warning. He is not attacking you. Release on my count. 1, 2, 3. Cole released the wrist. The technician stepped back, pale and embarrassed. Leah moved closer to the stretcher. I am placing my hand on your left forearm. Do it. Her touch was light. We need to transfer you to the scanner. 4 people will move the sheet beneath you. No one will touch your face. I will stay near your head. Cole nodded once. Paige Warren appeared at the doorway, carrying the transfer chart. That is exactly why psychiatric placement was ordered. Leah looked at her. He released the moment he understood what was happening. He could have injured someone. Someone entered his space without telling him. Paige lowered her voice. You are defending everything he does because he recognized you. I am explaining behavior before you label it. Weller stepped between them. Enough. Complete the scan. The transfer happened without resistance because Leah described every movement before it occurred. Cole listened to her count, held his breath when asked, and remained perfectly still inside the machine. The ordinary head CT appeared first. No large hemorrhage. No obvious major stroke. Weller studied the images through the control room glass. Nothing acute. Leah watched Cole on the table. His pupils remained open beneath the scanner lights, responding to brightness he could not interpret. The vascular study is next. Weller looked at the order. Radiology approved head angiography. The neck portion is under review. The pain begins in his neck. The previous trauma CT was normal. A routine trauma study can miss a dissection. You have not established that he has one. That is why we are looking. A woman in dark green scrubs entered the control room. Dr. Amara Singh was 43, compact, sharp-eyed, and known for correcting residents before they finished their first sentence. She glanced at Cole through the glass, then at the images. Sudden bilateral blindness after trauma? She asked. Progressive over 6 hours, Leah said. Reactive pupils, preserved light perception, inability to process forms, pulsatile sound in the left ear, posterior neck pain, and a transient right-sided deficit. Amara looked toward Weller. Why was this sent to psychiatric transfer? Multiple specialists considered the blindness irreversible. Based on the eyes? Ophthalmology suspected traumatic optic neuropathy. Amara enlarged the orbital images. The optic nerves are not normal, but they are not destroyed enough to explain complete bilateral blindness. Leah nodded. That is what I thought. Weller folded his arms. Or he has severe functional overlay. Amara gave him a flat look. Functional blindness does not usually produce facial weakness. The neck angiography was approved. Contrast entered Cole's IV. Leah spoke through the intercom. You may feel warmth in your chest and throat. It will pass. Stay with my voice. Cole's left hand moved once against the table. 1 tap. Leah understood it as yes. When the scan ended, the team returned him to the stretcher. His speech had improved, and he could lift the right arm again, though not as high as the left. Leah stood beside him with a small communication card. We need a simpler system. 1 tap of your left index finger means yes. 2 means no. Squeeze my hand if pain suddenly increases. Turn your face toward the sound if you can locate it. Cole gave 1 tap. Can you see any light right now? 1 tap. Can you see my outline? 2. Movement? 1. Only when I move close to a bright source. 1. She stepped in front of the examination lamp and raised 1 arm. Cole's eyes shifted toward the motion. Not accurately, but they shifted. Amara saw it. Visual motion processing may be partly preserved. Leah moved her hand from left to right. Cole tracked the direction late, as if the signal reached him through deep water. What do you see? She asked. Shadow. Shape? No. Color? No. When the neck pain worsens, does the shadow disappear? 1 tap. Do you become dizzy? 1. Nauseated? 1. Does the pulsing sound become louder first? Cole squeezed her hand. Pain. His face tightened. Now? 1 tap. Where? He guided her fingers toward the hollow behind his left ear without allowing her to press. The sound is louder? 1. Amara checked his eye movements. Look toward my voice. Cole turned slightly too far. Back toward Leah. He corrected more accurately. Amara repeated the test from different positions. Cole consistently located Leah's voice faster than anyone else's. Paige watched from the foot of the bed. He is choosing her. No, Amara said. He knows her acoustic pattern. Cole's mouth moved. 6 hours. Leah leaned closer. What happened for 6 hours? Followed you. The room quieted. Weller looked at Leah. During the classified operation? She ignored him. You never saw me? No. Not before tonight? No. How did you recognize me? Cole breathed carefully. 4 counts. Hold 2. Move on voice. The same cadence. The same pause between instructions. Leah felt snow against her face even though the room was warm. You remembered that for 7 years? Cole turned toward her. Kept us alive. Paige looked away first. The angiography images began loading on the monitor. Weller and Amara moved to the workstation while Leah remained beside Cole. He found her wrist with his left hand. You left. Her body went still. The mission ended. You disappeared after. I left the service. Why? Not now. His grip weakened but did not release. Thought you died. Leah looked down at his hand. I did not. Not what I meant. The words reached exactly where he intended. She had survived the operation. The woman named North Star had not. Amara called from the monitor. Leah. A thin, irregular line appeared along the left vertebral artery. Small. Easy to dismiss. The radiologist entered remotely through a video screen. Could be motion artifact. The vessel is patent. Leah moved closer. Compare it with the trauma scan from the day of the blast. Weller pulled up the earlier study. The first image had not been optimized for the vessel, but the outline was visible. The irregularity was smaller then. Amara measured both. It increased. The radiologist frowned. Minimal difference. Could be slice selection. What about the right vertebral artery? Leah asked. Amara changed the view. The vessel was extremely narrow. Not blocked. Born that way. Hypoplastic, she said. Weller leaned closer. Meaning? His left vertebral artery supplies most of the posterior circulation. Leah looked toward Cole. And that is the one with the irregularity. The radiologist remained cautious. Still not enough to call a dissection. Then order MRI diffusion and repeat vascular imaging with thin slices, Leah said. Weller shook his head. He has already undergone extensive testing. None during an active neurological episode. The weakness resolved. Cole spoke from the stretcher. Not first time. Everyone turned. Leah returned to his side. How many times? 3. Right arm every time? 1 tap. Speech? 1. Did you tell anyone? Rehab nurse. Page searched the transfer notes. There is a mention of brief right-hand clumsiness during therapy. How was it interpreted? Leah asked. Page's expression changed. Fatigue. A second note described slurred speech after standing. Dehydration. A third described sudden vertigo with vomiting. Medication reaction. 3 warnings. 3 different excuses. Weller closed the chart. We did not have those episodes here. You had the records, Leah said. They were not presented as stroke symptoms, because each person read them alone. Cole's left hand tightened around hers again. Pain. His breathing changed. Leah lowered her voice. Stay with me. Is the pulsing louder? 1 tap. Any weakness? He tried to lift the right arm. It moved only a few inches. Amara stepped forward. Facial symmetry. The right corner of his mouth began to fall again. Cole whispered, Light. What about it? Leah asked. Gone. Completely? 1 tap. His eyes no longer shifted toward the examination lamp. The shadow had disappeared. Weller reached for the stroke phone. MRI now. Leah kept her voice steady while the staff moved around them. You are in the emergency department. We found a vessel that may be injured. The weakness is happening again, but you are still here. Cole's fingers searched until they found hers. The dark. I know. His speech dragged across the final words. It's climbing. The second episode lasted 43 seconds. Cole's right arm weakened. His speech blurred, and the last trace of light vanished from his vision. Then the symptoms began to retreat. His fingers moved again. The corner of his mouth slowly lifted. By the time the MRI team reached the emergency department, he could speak in complete sentences. That did not reassure Leah. Transient symptoms meant blood flow had returned. They did not mean the danger had passed. Amara Singh stood beside the stretcher while the transport team prepared Cole for imaging. We need diffusion MRI of the brain, thin vascular sequences through the posterior circulation, and repeat angiography if anything changes. Conrad Weller looked at the clock. The scanner is backed up by 2 emergency cases. Move him ahead, Leah said. Weller turned toward her. 1 is a suspected brain hemorrhage, and this is a suspected posterior circulation stroke with recurrent deficits. The CT showed no large occlusion. The CT showed an artery changing shape after trauma. The radiologist called it uncertain. Amara closed Cole's chart. Uncertain does not mean harmless. He goes next. Weller made the call. Cole listened to the discussion without moving his head. His left hand remained wrapped around Leah's fingers. He could not see the room, but he could hear every hesitation. They still think I'm imagining it, he said. Leah lowered her voice. Amara does not. You? I think something is interrupting blood flow to the part of your brain that processes vision. My eyes work. They are carrying light. Then why can't I see? Because seeing is more than the eyes. Cole absorbed that in silence. Leah continued. The back of your brain receives the signal and turns it into shapes, movement, distance, and faces. If that area is not receiving enough blood, the eyes can remain intact while the world disappears. Can it come back? I do not know. He released her hand. The answer hurt him, but false hope would have hurt more. The MRI department was colder than the emergency wing. Leah described the room before Cole entered it. She told him the machine was a large white cylinder, that the table would move beneath him, and that the noise would sound like metal striking metal. I will be in the control room, she said. You will hear me through the speaker. No one touches my head without telling me. I will make sure of it. A technician approached with padded restraints. Leah announced every contact. He is placing support beneath your shoulders. Now a cushion under your knees. The head frame will touch both sides near your ears. Nothing will cover your face. Cole's breathing remained controlled. Weller watched from the doorway. He is remarkably cooperative with you. He is informed. That is not the only difference. Leah looked at him. No, it is the most important one. The machine began. Cole disappeared inside the scanner while Leah stood behind the glass with Amara and the radiologist. The first diffusion images loaded one section at a time. Frontal lobes clear, temporal regions clear. Then the occipital cortex appeared. Small bright points marked both sides. Amara leaned forward. There. The radiologist adjusted the contrast. Several punctate areas of restricted diffusion. Acute? Leah asked. Yes. Bilateral occipital ischemia. Weller entered the control room. How extensive? Small infarcts, the radiologist replied. Not enough to explain complete blindness by volume alone. Amara pointed toward the pattern, unless they are only the damage already completed. The remaining symptoms could be fluctuating perfusion. Leah studied the distribution. The spots appeared on both sides, scattered across territories supplied by the posterior circulation. Embolic, she said. The radiologist nodded reluctantly. Possibly. From the left vertebral artery? Possibly. Weller stared at the images. You both keep using that word. Because medicine does not become certain just because you are impatient, Amara said. The scanner moved to the vascular sequences. Cole's left vertebral artery appeared in thin gray layers. The wall narrowed, widened, then narrowed again beneath the skull base. Amara traced it with one finger. That is not a normal contour. The radiologist enlarged the segment. Could be a dissection flap. Could be? Leah asked. There is movement artifact. Cole has been perfectly still. The next sequence loaded. A dark crescent ran along the vessel wall. Blood inside the wall itself. The radiologist's expression changed. Intramural hematoma. Weller stepped closer. Meaning the artery is dissected? Yes. Leah looked toward the scanner. And the wider section? Possible pseudoaneurysm. The diagnosis had been hidden in pieces. Neck pain, pulsing in the ear, progressive blindness, brief weakness, small strokes. Each symptom had been assigned to a different explanation because no one had placed them on the same map. Amara ordered the scan stopped before contrast was repeated. Cole emerged from the machine pale but alert. Leah returned to his side. We found an injury in an artery at the back of your neck. From the blast? Most likely. Is that why I'm blind? It is sending small clots toward the visual parts of your brain. Cole's jaw tightened. Small. They have been small so far. He heard what she did not say. So far, Amara crouched beside the stretcher. The artery wall has split. Blood entered between its layers and formed a weak pocket. Small clots may be breaking away from that pocket. Fix it. We need to study the blood flow first. Why? Because your right vertebral artery is extremely narrow. You were born that way. The injured artery is carrying most of the blood to the back of your brain. Cole turned toward Leah's breathing. If they close it, Leah answered, they may remove the only reliable route. And if they leave it, another clot could travel farther. To where? Amara said. The basilar artery. It supplies the brainstem. Cole went very still. He understood anatomy well enough. Breathing, movement. Yes, Amara said. Consciousness, too. Weller moved toward the phone. Start anticoagulation. Amara stopped him. Not until neurointerventional reviews the pseudoaneurysm. It is standard treatment for dissection. If the pocket is unstable, Full anticoagulation may increase the risk of rupture, and withholding it allows more emboli. That is why this is not a routine protocol decision. Weller's frustration returned. Every minute we debate increases risk. Leah looked at him. Then stop debating whether the diagnosis exists. The words landed harder because the images were still visible behind them. A neurointerventional specialist reviewed the study remotely. He recommended intensive monitoring, antiplatelet therapy, and catheter angiography as soon as a specialized suite became available. Until then, Cole would remain flat enough to protect circulation, but not so flat that nausea threatened his airway. Weller ordered transfer to neurological observation. Leah objected. He belongs in the neuro-ICU. There are no beds. He has had 2 transient deficits in less than an hour. He is currently stable. Stable is a moment, not a destination. Weller's expression hardened. Observation is 30 feet from intensive care. Continuous monitoring. Stroke-trained nurses. This is not a psychiatric transfer. It was an improvement. Not enough, but real. Cole was moved to a monitored room while the angiography team prepared. Leah remained with him. Paige Warren stood near the door, no longer joking. I read the original ophthalmology report, Paige said. The pupils were reactive from the beginning. Leah did not look up from Cole's blood pressure. Yes, they still called it traumatic optic neuropathy. They wrote possible traumatic optic neuropathy. Then everyone after them removed the word possible. Cole heard that. Easy, Paige whispered. One uncertain line becomes fact after enough people copy it. Leah finally looked at her. That is how patients disappear inside records. Paige's eyes moved toward Cole. I should not have used him to embarrass you. No. I thought he was difficult. You knew he was blind. That does not excuse how he acted. No. But it should have made you ask what happened before he reacted. Paige nodded slowly. I am asking now. Cole turned toward her voice. Start with warning people before you touch them. I will. The apology did not repair the morning. It changed what happened next. Cole suddenly squeezed Leah's hand. Hard. She leaned closer. Pain? 1 tap. Left neck? 1. Pulsing louder? 1. His stomach tightened. I'm going to be sick. Leah rolled him carefully onto his side and called for suction. Cole vomited before the nurse reached the bed. His body shook with violent vertigo even though he was not moving. Amara entered during the second wave. Eye movements. Cole's eyes pulled downward and to the left, then corrected. New nystagmus, she said. His pulse fell from 92 to 58, then climbed past 120. Blood pressure rose sharply. Weller arrived with the stroke team. Repeat CT. Amara shook her head. Catheter suite now. It is not ready. Then make it ready. Cole tried to lift his head. Leah kept one hand near his shoulder. Stay down. Follow my voice. Can't find... His words slurred. Center. What center? Everything moving. His right hand stopped gripping hers. Leah lifted his arm. It fell. Again. The third episode was worse. His right leg did not respond either. Amara checked his face. Cole, show me your teeth. Only the left side moved. Weller activated another stroke alert while transport arrived. We repeat vascular imaging on the way to intervention. Cole's breathing became uneven. Leah walked beside him as the stretcher entered the corridor. You are moving toward radiology. Straight for 20 feet. Left turn coming. His face remained toward her voice. North Star. I'm here. Do not let them sedate me. Not without explaining why. I need to hear. You will. The portable scanner team completed a rapid angiographic sequence near the interventional suite. The new images loaded while Cole waited beneath bright lights. The pseudoaneurysm had enlarged. A clot now occupied part of the left vertebral artery. Amara followed the vessel upward. The clot extended farther than before, toward the point where both vertebral arteries joined. Weller's face lost color. How much time? No one can answer that, Amara said. The interventional specialist entered, already pulling on a protective gown. We need access now. Leah looked at the final image. The clot had not yet sealed the basilar artery, but it was close enough that the next movement could take Cole's sight, speech, and body, while leaving his mind awake inside them. Amara pointed to the narrow space still carrying blood. That is all he has left. The interventional suite was ready in less than 6 minutes. Cole was transferred beneath a ceiling of white lights, while nurses connected new monitors and prepared his right wrist for arterial access. The neurointerventional specialist introduced himself as Dr. Nathan Keller, but Cole's face remained turned toward Leah. "Tell me what they are doing." "They are cleaning your wrist," Leah said. "Dr. Keller plans to guide a catheter through the artery in your arm and study the blood vessels behind your brain." "Will I be awake?" "For the first part." "Stay where I can hear you. I'm at your left shoulder." Cole's fingers moved once against the sheet. "Yes." Keller examined the images while Amara stood beside him. "The clot is unstable. If we manipulate the vertebral artery without protecting the basilar junction, we could send the entire thing forward." "And if we wait?" Weller asked. "It may travel on its own." Cole heard every word. Leah leaned close enough that he did not have to search for her voice. "They are trying to choose the safest route. There isn't one." "No." "Good." She frowned. "Good? You didn't lie." A nurse injected local anesthetic near his wrist. Leah warned him before the needle entered. His breathing accelerated, then followed her count. 4 in. Hold 2. Release slowly. Keller advanced the catheter while the first angiographic images appeared on the monitors. Contrast filled the right vertebral artery. The vessel was barely larger than a thread. "Congenitally hypoplastic," Amara said. "It contributes almost nothing." The catheter moved to the left side. The injured artery appeared beneath the skull base. A narrow channel passed through a swollen segment before widening into the pseudoaneurysm. The clot moved slightly with each heartbeat. Keller froze the image. "That pocket is larger than the MRI suggested." Weller stared at the screen. "Can you stent it?" "Not safely with the equipment currently in the room. The vessel curves sharply before the lesion, and the distal landing zone is short. Could you remove the clot first? If it fragments, we lose the basilar artery." Cole's pulse climbed. Leah spoke immediately. "Stay with my voice. The artery is still open. They are studying its shape." Keller looked over his shoulder. "Who is she?" "Dr. Leah Serrano," Weller said. "I know her name." "Why is the patient responding only to her?" No one answered quickly enough. A hospital administrator entered through the control room door. She wore a charcoal suit beneath a disposable protective gown and carried a tablet against her chest. "Dr. Weller, we have a disclosure problem." Weller's jaw tightened. "This is not the time." The patient identified Dr. Serrano by a military designation. Security reviewed the deleted recording log and notified Naval Liaison. Dr. Serrano did not disclose a previous operational relationship. Cole heard the words through the open door. His hand tightened. Leah remained beside him. "Cole, I'm still here." The administrator approached the table. "Dr. Serrano, did you previously treat this patient?" "Not in a hospital." "Did you serve in the same unit?" "No." "Did you participate in an operation involving him?" "Yes." Cole turned toward the administrator's voice. "She stays." "This is a medical conflict of interest review, Chief Maddox." "She stays. We have to determine whether your consent is being influenced by a prior relationship." Cole's expression hardened. "My consent is being influenced by the fact that she is the only person in this building who listened before I started having strokes." Weller stepped closer to the table. "No one is removing her from the hospital. She may need to leave the procedure area temporarily." Cole's pulse rose above 130. The clot shifted on the live screen. Keller looked up sharply. "Keep his pressure controlled." A nurse reached for Cole's arm. He pulled away. Leah intervened before the movement became violent. "Cole, a nurse is approaching your left IV. She needs to give medication to lower your blood pressure. She will touch your forearm only." Cole's hand opened. The nurse administered the medication. Keller watched the clot settle. "Every surge in pressure increases the risk of embolization. I need him calm." The administrator looked at Leah. "Then explain the prior relationship now." "Not here," Weller said. "Here," Cole replied. Leah looked down at him. He could not see her hesitation, but he heard it. "You owe them nothing," she said. "I owe you the truth." The suite became quiet, except for the monitor and the soft mechanical pulse of the angiography equipment. Cole faced the ceiling. 7 years ago, my team was sent through the Kandar Range during Operation White Lantern. The official route collapsed before extraction. Snow cut visibility to nothing. An explosion took my sight for most of the night. The administrator glanced toward Weller. That operation remains restricted. Cole continued. Then restrict your ears. Even Keller looked away from the monitor. Cole's voice weakened but remained steady. We had 6 wounded men, 1 radio, and no way to see the terrain. A flight physician found our signal. She guided us through the mountain 1 step at a time. Leah's throat tightened. Cole turned toward her. She never gave us her name. Only a call sign. The suite doors opened behind them. A tall woman in a dark Navy service uniform entered with 2 security officers. Silver showed at her temples. Her expression carried the authority of someone accustomed to entering rooms after everyone else had already made mistakes. Captain Elena Brooks, she said. Naval Special Warfare Medical Liaison. The administrator straightened. Captain, this is an active restricted procedure. I know exactly what it is. Brooks approached the table and looked at Cole. Chief Maddox. Ma'am. He attempted to raise his hand, but the right arm responded too slowly. Save your strength, Brooks said. Her attention shifted to Leah. Dr. Serrano. Leah had not seen her in 6 years. Captain. Brooks placed a sealed folder on the counter. I was informed that the hospital had questions about Dr. Serrano's connection to the patient. We need to determine whether she should remain involved, the administrator said. Brooks opened the folder. Then you need the facts. She removed a redacted mission report, a flight medical record, and a faded black patch embroidered with a white 8-pointed star. Cole could not see it. Leah could. North Star. The patch had once been attached to the medical bag she carried during night extractions. Brooks held up the report. Doctor? Leah Serrano served as a flight physician and remote evacuation coordinator with a joint rescue detachment. Her operational designation was North Star. Paige Warren had arrived outside the control room glass with several members of the emergency staff. She stared through the window as Brooks spoke. During Operation White Lantern, Brooks continued, Chief Maddox's team was trapped after a mountain passage collapsed. An explosion damaged his vision. Weather prevented aircraft from landing, and enemy movement blocked the primary ground route. Weller looked at Leah. You directed the extraction? From an aircraft that could not descend through the storm, she said. Brooks nodded. For 6 hours, Dr. Serrano used satellite imagery, thermal mapping, and radio reports to guide 7 men through terrain none of them could see. Cole corrected her quietly. 6 came out. Leah's eyes lowered. Brooks paused. The silence revealed more than the report. Weller looked between them. That is why he recognized her voice. Not just the voice, Cole said. The timing. Brooks placed the patch beside the angiography monitor. North Star used a 4-count breathing command during movement. 4 seconds to inhale. Hold for 2. Move only after her voice. It kept the injured men from panicking and helped her estimate their pace through the pass. Amara looked at Leah. You used the same command in Trauma 4. I did not realize it until he responded. Cole turned toward the sound of her breathing. I did. The administrator studied the documents. Did Dr. Serrano have a personal relationship with Chief Maddox after the operation? No, Brooks said. They never met face to face. She remained aboard the command aircraft. Chief Maddox was evacuated before visibility returned. You had never seen her? Weller asked. Not once. And you recognized her 7 years later after one instruction? Cole's mouth tightened. When the world goes black, and one voice leads you out, you remember it. No one behind the glass moved. Brooks looked at the hospital administrator. There is no undisclosed personal relationship. There is operational history. Removing Dr. Serrano may satisfy a policy designed for ordinary circumstances, but it will destabilize the patient during an active cerebrovascular emergency. Keller nodded toward the live image. She is clinically useful. His blood pressure responds to her faster than it responds to medication. The administrator did not surrender easily. She may remain as a communication support physician, but she cannot make independent treatment decisions. Leah answered immediately. Agreed. Cole's hand searched along the sheet. Leah placed her fingers beneath his. 1 tap. Yes. Keller returned his attention to the angiogram. We need a flow-preserving stent and distal protection device from the main neurovascular center. It will take approximately 40 minutes. 40 minutes? Weller asked. We cannot close the vessel. The right side will not support his posterior circulation. We need to remove the clot and repair the pseudoaneurysm while preserving the left vertebral artery. Amara studied the screen. Can we keep the catheter in position? Not safely. Any movement from the patient could advance the clot. We withdraw, maintain controlled blood pressure, start carefully selected antiplatelet therapy, and return when the equipment arrives. Cole's fingers pressed into Leah's hand. 40 minutes in the dark, he said. You have already survived longer, she replied. Because you were talking. I am not leaving. Keller withdrew the catheter slowly. The clot remained in place. For the moment. Cole was transferred to a holding bay beside the suite under continuous neurological monitoring. Every 2 minutes, Leah tested his speech, grip, and ability to locate her voice. His right side recovered again, but each return was weaker than the one before. Brooks remained near the doorway. When Cole's condition stabilized, Leah approached her. You should not have brought the patch. You should not have disappeared. I resigned. You resigned from the detachment. You did not have to erase yourself. Leah looked through the glass at Cole. 6 men came home. Brooks understood what she meant. 1 did not. Leah's voice dropped. Aaron Pike remained at the southern passage because I ordered the team north. If I had chosen the other route collapsed 12 minutes later. We did not know that when I made the decision. You had incomplete information and wounded men freezing on a mountain. I chose who moved and who stayed. No, Pike chose. Leah looked at her. Brooks opened the mission folder again. There was a final transmission that never appeared in the medical debrief you received. That is impossible. It was recovered from the ground radio 3 days later. Command sealed it with the operational file. Why? It contained location data and names. Then the investigation closed, and everyone assumed you had heard it through the aircraft channel. Leah's face lost color. Brooks removed a single transcript page. Cole listened from the bed. What did he say? Leah asked. Brooks held the page, but did not read immediately. Her eyes moved from Leah to the blind man who had followed that voice through a mountain and recognized it years later in a hospital room. Aaron Pike did not believe you abandoned him, Brooks said. His final message was for North Star. Captain Elena Brooks placed the transcript on the counter between them. Leah did not reach for it. For 7 years, she had built an entire life around one conclusion. Aaron Pike had died because she chose the wrong route. She had replayed the storm, the broken radio traffic, and the satellite map until memory became punishment. Every version ended the same way. 6 men moving north. 1 man left behind at the southern passage, her voice giving the command. Brooks tapped the page. Read it. Leah's hand remained at her side. You read it. Cole lay in the holding bay behind the glass, blind eyes open, monitors tracing each heartbeat. He had heard the conversation. Even with the equipment humming around him, he seemed to be waiting for the words as carefully as Leah was avoiding them. Brooks looked down at the transcript. Ground transmission recovered from operator Aaron Pike. Timestamp 0342. Leah felt the mountain return. The cold had been violent that night. Snow had struck the aircraft windows hard enough to sound like gravel. Through the radio, men breathed like animals running out of strength. Brooks continued. North route remains passable. South support is failing. I am holding the gate until Mako gets the wounded through. Cole's jaw tightened at the sound of his old call sign. Leah whispered. He knew the south route was collapsing. He was standing inside it, Brooks said. The memory broke open. 7 years earlier, the command aircraft had circled above the Kandar range while the storm erased the ground. Leah sat strapped beside a communications console, one hand pressed to her headset, the other moving across a thermal map that updated too slowly. Mako, confirm number of ambulatory personnel. Cole's younger voice had come through in fragments. 3 walking, 2 assisted, 1 litter. Pike at rear security. Distance to the north split? Unknown. Visibility 0. Use the rock wall on your right. Keep contact with it. 12 steps forward, then stop. A blast had damaged Cole's sight less than an hour before. He could distinguish light, but not terrain. The other men could barely see beyond their own hands. Leah had become their map. "Breathe on 4, she told them. "Hold for 2. Move only on my voice." One step at a time, she guided them through the pass. The southern route appeared shorter on satellite imaging, but heat signatures showed instability along the slope. The north route climbed higher and exposed them longer to the storm. Leah had less than a minute to choose. "Take the north split." Pike's voice entered the channel. "I'll hold the rear." "No," Leah said. "Stay with the team." "Negative. Passage is narrowing. Someone has to keep the litter clear." "Pike, move north," Static answered. Then Cole's voice. "He's not moving." Leah remembered gripping the headset so hard that pain traveled into her wrist. "Pike, that is a direct medical evacuation order." His answer came calm. "North Star, your patients are moving. Do not turn them around." The line had cut before she could respond. For years, that had been the last thing she believed he said. Brooks turned the transcript page. There was another transmission 41 seconds later. "It never reached your aircraft channel." Leah looked at the paper but still could not touch it. Brooks read the final message. "Tell North Star the route held because she chose the living. Tell her not to carry me out of this mountain." Leah stopped breathing. Cole lifted his left hand from the bed and placed it against the rail. Brooks continued, softer now. Final line. "I stayed before she gave the order." The room seemed to lose all sound. Leah saw the aircraft interior, the red emergency lights, and the map that had remained on the screen long after the survivors reached extraction. She remembered asking where Pike was. She remembered the silence from the ground team. She had resigned before the official investigation closed. "Why was this never given to me?" she asked. "The transmission was recovered from damaged equipment," Brooks said. "It became part of a classified operational review. Your medical debrief had already been completed. Then you requested separation from the unit. You knew I blamed myself. I knew after you disappeared. By then, the recording was sealed. You could have found me. I should have." Leah looked through the glass toward Cole. He could not see her, but he turned toward the silence she had left behind. "Mako," she said. His fingers moved once against the rail. "Yes. You knew? Not the message. You knew Pike chose to stay. We all knew. Why didn't you tell me?" Cole swallowed. "Never found you. You could have asked command." "I did," Brooks answered for him. "Your records were restricted after you resigned. The official response was that North Star had been reassigned." Leah almost laughed, but no sound came. "Reassigned," as if grief were a posting. Cole's voice came rough. "Thought maybe you wanted no contact. I thought none of you wanted to hear from me. You got us out. I left him. He stayed." The distinction had always existed. She had simply refused to see it. Leah finally took the transcript. The paper trembled slightly in her hand. Aaron Pike's final words were typed in clean black letters, too orderly for the storm that had carried them. "Tell North Star the route held because she chose the living." For 7 years, she had believed North Star was the name of the woman who abandoned a man in the dark. Pike had remembered her as the one who saved the others. A monitor alarm sounded behind the glass. Leah turned instantly. Cole's heart rate had climbed to 140. His face tightened, and his left hand moved toward the back of his neck. She entered the holding bay with Amara close behind. "Pain increasing?" Leah asked. 1 tap. "Pulsing louder?" 1. "Any nausea?" Cole squeezed her fingers. Amara checked his pupils. They remained reactive, but his eyes drifted left. "Cole, lift both arms." The left rose, the right barely moved. His speech came thick. "Again." Leah looked at the monitor. "How long since the last episode?" 11 minutes, Amara said. The intervals were shrinking. Keller entered carrying an updated angiographic image. The transport team is 6 minutes away with the flow-diverting stent and distal protection device. "Can he wait 6 minutes?" Weller asked. Keller did not answer immediately. The clot had advanced. It now occupied more of the narrowed channel beneath the pseudoaneurysm. Amara studied the image. "Start the antiplatelet loading dose." Keller hesitated. If the pseudoaneurysm ruptures, if we do nothing, the artery closes. Weller looked between them. What is the survival difference? No honest percentage, Keller said. Without intervention, he has repeated emboli or complete basilar occlusion. With intervention, we risk rupture, dissection extension, or moving the clot ourselves. Cole heard every word. Do it, he said. Leah leaned closer. They need formal consent. Then ask. Keller approached the bed. Chief Maddox, we plan to enter the artery through your wrist. First, we will place a temporary protection device near the basilar junction. Then, we will try to remove the clot and place a stent across the damaged segment. Will it restore my sight? It may prevent further damage. Some vision may return if the tissue is underperfused rather than dead. But I cannot promise that. Can it kill me? Yes. Can waiting kill me? Yes. Then stop waiting. Keller nodded to the nurse. She prepared the consent tablet. Cole could not see the signature line. Leah guided his left hand to the surface and described where to place his mark. Before he touched it, he stopped. One condition. Keller looked at Leah, already understanding. She stays. The hospital administrator stood beyond the glass. Dr. Serrano may remain for communication support, but not as the procedural decision-maker. That's enough, Cole said. Leah placed her hand beneath his. He signed. The transport case arrived 2 minutes later. Inside were the specialized stent, microcatheters, and protection device Keller had requested. The team moved with controlled urgency. Amara reviewed the neurological exam again. Right arm 2 out of 5, right leg 3 out of 5. Speech mildly dysarthric, consciousness intact. Cole's face turned toward Leah. How bad? The right side is weaker than before. Vision? Can you detect the ceiling light? He waited, then gave 2 taps. No. Not even brightness remained. Keller looked at the clock. We proceed now. As the team prepared to return Cole to the procedure table, Brooks stepped beside Leah. You do not have to carry Pike into that room. Leah looked at the old North Star patch still resting near the mission file. I carried him everywhere else. Then leave him here. Leah touched the edge of the patch. The fabric was worn where her thumb used to rub it during difficult extractions. She placed it inside her scrub pocket. No, she said. This time he comes with me for the right reason. Cole was moved beneath the angiography lights again. His breathing accelerated as the staff surrounded him. Leah took her place near his left shoulder. I am here. His fingers searched until they found hers. North Star. Leah is fine. Not in the dark. She understood. North Star was not the uniform, the aircraft, or the mission report. It was the voice he trusted when he had no other direction. Then North Star is here. His hand relaxed slightly. Keller began explaining the procedure one final time. We will use light sedation, but we want you responsive during the early stages. Dr. Serrano will test your speech and movement. If we need deeper anesthesia, we will tell you first. Cole nodded. Amara leaned toward Leah. If the basilar artery closes, he may lose movement before consciousness. He could remain aware, but unable to respond. Leah looked at Cole's face. He had survived temporary blindness on a mountain by following her voice. Now he faced something worse than darkness. The possibility of hearing the world while being unable to prove he was still inside it. Keller positioned the catheter at Cole's wrist. Ready. Leah tightened her hand around Cole's fingers. Breathe on 4. Hold for 2. Move only on my voice. He inhaled. 1, 2, 3, 4. The monitor steadied. Amara watched the neurological tracing while the catheter advanced. Then Cole's grip weakened. His lips moved with sudden difficulty. Can't feel. Where? Leah asked. Right side. Amara tested his leg. No response. Keller looked at the live image. The clot had shifted again, closer to the basilar junction. Amara's voice became urgent. We are out of observation time. Keller advanced the protection device. Cole tried to turn toward Leah, but his neck no longer obeyed completely. She kept speaking as the team moved faster around him. You are still here. Follow my voice. His left fingers gave one faint tap. Amara stared at the screen. If that artery closes before we reach it, he may remain conscious inside a body that can no longer move. The catheter moved through Cole's radial artery, while Leah watched the strength leave his right side. "Cole, squeeze my hand." His left fingers closed weakly around hers. Again. A second squeeze. "Lift your right thumb." Nothing. Amara Singh checked his face. The right corner of his mouth had fallen lower, and his eyes no longer shifted toward Leah's voice. "He is progressing," Amara said. "We need distal protection immediately." Nathan Keller guided the microcatheter upward through the vessels of Cole's arm and chest. On the monitor, a thin white line advanced toward the injured vertebral artery. "Pressure is increasing," the anesthesiologist warned. Leah stayed close to Cole's left ear. "Breathe with me. 4 in. Hold for 2. His chest rose unevenly. 1, 2, 3, 4. He held. "Release." The blood pressure lowered by 6 points. Keller glanced toward Leah without taking his hands from the controls. "Keep doing that." Cole's left fingers remained wrapped around hers. The grip was not strong, but it proved that he could still hear and respond. The protection device reached the curve below the pseudoaneurysm. Keller stopped. The vessel turns more sharply than the scan showed. Amara studied the live angiogram. "Can you cross it?" "Not with the current angle. If the wire presses against the dissected wall, we could extend the tear." Weller stood behind the control console in a protective apron. He had stopped defending the earlier diagnosis. Now he watched the artery as if every decision made before this room had narrowed into the same dangerous channel. "What is the alternative?" he asked. "Reshape the microcatheter and approach from a lower angle." "How long?" "Several minutes." Cole's grip tightened suddenly. Leah leaned toward him. "Pain?" "1 squeeze." "Back of the neck?" Another squeeze. "Pulsing?" A third. The monitor showed a brief, irregular rhythm. Keller looked at the pseudoaneurysm. The clot inside it moved with each heartbeat, held by only a narrow attachment to the damaged wall. If that breaks free before the protection device is above it, we have no safety net. Amara checked Cole's right hand again. Still no movement. Leah said, "Cole, can you move the fingers of your left hand one at a time?" His index finger lifted, then the middle finger. The ring finger barely moved. "Good. Stay with that side." His voice came faintly. "Dark. I know. Different. What changed?" "Quiet." Leah looked at Amara. "What does that mean?" Amara asked. Cole struggled to form the words. "Sound. Far." Amara touched both sides of his face with cotton after warning him. He detected the left side immediately and responded late on the right. "Possible brainstem involvement," she said. Keller withdrew the wire by a few millimeters, rotated the catheter, and advanced again. The tip passed the first curve. Almost there. Leah watched Cole's breathing. He was awake, but the effort required to remain connected to the room was increasing. "Tell me where you are," she said. "Hospital." "Which room?" "Procedure." "Who is beside you?" A pause. "North Star." "That is right." Cole's left thumb moved against her palm. She remembered the mountain radio. Visibility had been 0 then, too. She had kept the men oriented by asking simple questions. "What do you hear? What is beneath your boots? Who is touching your shoulder?" The answers had built a world when their eyes could not. "Cole, tell me what you hear now." "Monitor." "What else?" "Air vent." "What else?" His brow tightened. "Your voice." "Stay with those 3 things." Keller advanced the protection device beyond the injured segment and opened a small filter near the basilar junction. Protection deployed. Amara exhaled. Now the clot. Keller introduced a smaller aspiration catheter. The plan was to enter the pseudoaneurysm carefully, remove the unstable clot, and then place a stent across the damaged vessel wall. The catheter approached the swollen pocket. Cole's heart rate rose again. Leah counted his breathing. 4 in. Hold 2. Release. The numbers steadied. Keller applied gentle suction. Dark material entered the aspiration tubing. Clot is coming. For the first time, the angiographic image showed more blood moving through the narrowed channel. Weller leaned closer. Flow improved. Partially, Keller said. There is still clot along the distal edge. He repositioned the catheter. Cole's left hand went slack. Leah immediately tightened her fingers around his. Cole, squeeze. No response. Cole, squeeze my hand. His index finger moved once, barely touching her skin. Amara looked at the monitor. He is still following commands. Keller continued aspiration. A second fragment entered the tubing. Then the catheter jumped. Not far. Only a few millimeters. But everyone in the room saw the remaining clot detach from the pseudoaneurysm. It moved upward. The protection filter caught part of it. Another fragment passed along the edge. Distal embolus, Keller said. Amara turned to the neurological monitor. Where is it going? Keller injected contrast. The fragment traveled into the basilar artery. The room changed from controlled urgency to immediate danger. Prepare thrombectomy device, Keller ordered. The anesthesiologist adjusted the medication. Do you want full anesthesia? Not yet. I need neurological response. Amara leaned over Cole. Cole, open your mouth. He obeyed slowly. Move your left foot. The foot shifted beneath the sheet. Move your right foot. Nothing. Show me 2 fingers with your left hand. His index and middle fingers rose. Leah spoke close to him. You are still with us. A piece of the clot moved forward. They are going after it. Cole's lips moved. Basilar? Yes. He knew exactly what that meant. Lock me in. We are not there yet. Don't lie. I am not. You are still answering. Keller threaded a thrombectomy catheter toward the basilar artery. The fragment had lodged along the vessel wall, but had not completely stopped blood flow. Partial occlusion, he said. We still have a channel. Amara watched Cole. Speech is worsening. Leah asked. Cole, what is your name? Maddox. First name? Cole. Where are you? His answer came after several seconds. Mountain. Leah's chest tightened. You are not on the mountain. You are in Chesapeake Naval Medical Center. Bright room. 7 people around you. My hand is holding yours. Cole's eyes moved beneath his lids. Snow. There is no snow. Can hear it. The medication, low blood flow, and old memory were beginning to overlap. Leah changed her tone to the one she had used through the storm. Mako, listen to North Star. The route ahead is open. Do not move until I tell you. Cole became still. Keller looked up briefly. Whatever you are doing, continue. The ground under you is stable, Leah said. You are not alone. 1 step at a time. Cole's left index finger tapped against her palm. Keller advanced the device through the remaining channel. The clot fragment appeared ahead of it. Crossing now. The wire passed. Device opening. A small mesh structure expanded beyond the clot. Keller waited for it to engage. 30 seconds felt longer than the 7 years Leah had spent avoiding the memory of White Lantern. Cole's breathing slowed. Too much. The anesthesiologist checked the airway. Respiratory effort decreasing. Cole, Leah said. Take a breath. His chest rose shallowly. Again. 4 counts. He managed 2. Then stopped. The anesthesiologist lifted his jaw and increased oxygen. I may need to intubate. Tell him first, Leah said. The anesthesiologist leaned close. Chief Maddox, your breathing is weakening. I may place a tube to breathe for you. Cole's eyes opened slightly. No. You may not be able to protect your airway. Wait. Amara checked the oxygen level. 93 and falling. Leah watched Cole's face. You need to breathe with me now. Not later. His chest rose. 1, 2, 3. The breath ended before 4, but the oxygen climbed to 95. Keller began withdrawing the thrombectomy device. Clot engaged. The mesh and aspiration catheter moved together. Everyone watched the basilar artery. Halfway back, resistance appeared. Keller stopped. It is caught at the vertebro-basilar junction. Can you increase aspiration? Amara asked. If I pull harder, I may strip the vessel wall. And if you release, it may embolize again. Cole's left fingers trembled. Leah said, Stay with my voice. His thumb tapped once. Keller increased suction gradually and rotated the device by a fraction. The clot shifted, then entered the catheter. Removed. Contrast flowed through the basilar artery again. The room exhaled. But Keller did not. There is another filling defect. A smaller clot had moved into a branch leading toward the brainstem. Amara looked at Cole. Test him, Leah squeezed his hand. Cole? Squeeze back. Nothing. Cole, move your left index finger. The finger remained still. Amara called his name loudly. No response. The anesthesiologist pressed against his nail bed. Cole did not withdraw. Pupils still reactive, Amara said. Breathing spontaneous but shallow. Leah leaned closer until her mouth was inches from his ear. Mako, this is North Star. Move one finger. Nothing. Keller advanced a smaller device toward the branch vessel. Weller stared at the neurological display. Is he unconscious? Amara shook her head. We do not know. Leah refused to let go of his hand. Cole, hear me. You are in the hospital. The main clot is out. They are reaching the last one now. His face did not change. No movement. No sound. No proof that her words reached him. The monitors continued tracing a living heartbeat, while the man beneath them disappeared behind a body that would no longer answer. The smaller clot had lodged where the basilar artery divided into a narrow branch feeding the brainstem. Blood still passed around it, but not enough. Cole's breathing continued without assistance, shallow and uneven, while every attempt to make him move failed. Nathan Keller advanced the microcatheter by fractions of a millimeter. The branch is too small for the first device. I need the miniature retriever. A nurse opened the emergency tray. Amara Singh remained over Cole, testing every response she could reach. She pressed against his left palm, called his name, and touched his shoulder after warning him, even though there was no sign he understood. Conrad Weller watched the monitor. Could the sedation explain this? Not all of it, Amara said. He was responding at the same dose 3 minutes ago. Then he has already infarcted. Or he has temporary brainstem ischemia. Leah still held Cole's left hand. It felt warm and alive, but completely absent from hers. She had experienced this silence once before. On the mountain, one of the wounded men had stopped responding after slipping beneath the snow. The others believed he was unconscious. Leah had continued giving instructions until his radio clicked twice. He had been awake, buried, and unable to speak. A body could become silent before the person inside it disappeared. Mako, she said close to Cole's ear, you do not need to move your whole hand. Give me the smallest response you can. Nothing happened. Keller inserted the miniature retrieval device. The branch vessel curved sharply away from the main artery. Each heartbeat moved the clot against the wall, threatening to push it farther into vessels too small to reach. Crossing the obstruction, Keller said. Leah shifted her thumb beneath Cole's index finger. You used one tap for yes. I only need pressure, not movement. Press against me. His finger remained motionless. Amara glanced at Leah. Keep talking. Leah looked at Cole's face. The fear was no longer visible there. His features had become too still for emotion, as though the body had closed every unnecessary door to preserve what remained. You told me not to lie, she said. So here is the truth. A small clot is blocking blood flow to part of your brainstem. Dr. Keller has reached it. Your heart is strong. You are still breathing. We do not know how much you can hear, but I am going to assume you hear everything. The thrombectomy device opened beyond the clot. Keller waited for the mesh to settle around it. Leah continued, You are not on the mountain. There is no snow beneath you. Your boots are not against rock. You are on a procedure table. My hand is under your left hand. The air is warm. The lights are bright, even if you cannot see them. Cole's fingertip pressed into her thumb. So faintly that Leah almost believed she had imagined it. She stopped speaking. Again, she whispered. A second pressure came. Amara saw it. Command response. Weller stepped closer. Are you certain? Leah repositioned her thumb. Cole, press once if you hear me. The fingertip pushed down. One clear answer. He is conscious, Amara said. The words changed the room. Cole was no longer an unresponsive body waiting for the procedure to decide his fate. He was a man listening from inside a failing neurological system. Keller's voice remained controlled. Clot engaged, beginning retrieval. The device moved backward. Blood pressure fell. The anesthesiologist adjusted medication and fluids. Systolic 86. Keep it above 100. Amara said. He needs perfusion. Leah felt Cole's finger lose pressure. Stay with my voice. No response. Keller withdrew another millimeter. Resistance. Vessel spasm? Amara asked. Possibly. The branches closing around the device. A medication was delivered through the catheter to relax the vessel. The artery widened slightly, but the clot did not move. If I pull now, I could tear the branch, Keller said. If you wait, the tissue remains ischemic, Weller replied. Keller did not look away from the screen. I am aware. Leah leaned closer to Cole. Mako, the root narrowed. That does not mean it is closed. His finger pressed once. The room heard Leah's next words, but they belonged to another night. On my voice, not the dark. Keller rotated the device by a fraction and increased aspiration. The clot shifted, moving. Amara watched the flow map. Slowly, the device passed the curve, bringing a thin red fragment into the catheter. Keller continued aspiration until the clot disappeared from the vessel. Retrieved. Contrast entered the artery. The branch filled. Blood reached the brainstem again. Amara placed 2 fingers against Cole's palm. Cole, squeeze. Nothing. Leah repeated the command in the cadence he trusted. On my voice. Squeeze, now. His hand closed around hers. Weak, incomplete, but intentional. The anesthesiologist exhaled. Weller lowered his head for a moment. Amara immediately began testing further responses. Move your left foot. The toes shifted beneath the sheet. Right foot. No movement. Open your eyes. Cole's eyelids lifted. His gaze remained fixed and blind, but he was awake. Leah felt his grip tighten by 1 degree. North Star. The word was barely more than breath. I'm here. Keller returned his attention to the injured vertebral artery. Removing the embolus had prevented the immediate catastrophe, but the source remained behind it. The pseudoaneurysm still contained unstable material, and the torn arterial wall could release another clot at any moment. We still have to repair the dissection, Keller said. Amara checked the clock. Neurologically, he is improving. Right side still absent. Can you continue? Weller asked. If we stop, we leave the source open. Keller advanced the flow-preserving stent through the left vertebral artery. The device was designed to cover the damaged segment while allowing blood to pass through the vessel. Its placement required precision. Too low, and part of the pseudoaneurysm would remain exposed. Too high, and the stent could interfere with a branch supplying the brain. Leah explained each stage to Cole. They removed the clot from the brainstem vessel. Blood is flowing again. Now they are placing a support inside the injured artery to prevent another clot. Right side? Still not moving. Permanent. We do not know. He swallowed. Vision? Still dark. 1 weak squeeze. Yes. Keller positioned the stent across the pseudoaneurysm and began deployment. The metal mesh opened against the vessel wall. Halfway through, the device stopped expanding. Undersized segment, Keller said. The artery is wider inside the damaged pocket. Can you reposition? Amara asked. Not after partial deployment. Blood entered the pseudoaneurysm around one edge of the stent. The weakened pocket swelled. A nurse called out the pressure increase. Keller introduced a small balloon catheter through the stent. I can press the mesh against the healthy wall, but inflation may rupture the lesion. Weller looked at the live image. And without it? Blood continues entering the pocket. It may rupture anyway. Cole's breathing accelerated again. Leah counted. 4 in, hold 2, release. He followed until the 3rd breath, when pain tightened his face. Neck, he whispered. The vessel is being repaired. Feels hot. Amara checked the monitor. No new deficit on the left. Keller positioned the balloon. Inflating. The balloon expanded inside the stent. The pseudoaneurysm changed shape. For 1 terrifying second, contrast appeared beyond the expected vessel boundary. Possible leak, Weller said. Keller stopped inflation. Everyone watched. The contrast remained contained within the vessel wall. No rupture, Keller said. It was pocket filling. He inflated again at lower pressure. The stent pressed outward and sealed against the artery. Blood flow redirected through the center of the device, while circulation inside the pseudoaneurysm slowed. Good wall contact, Keller said, testing final flow. Contrast traveled through the left vertebral artery, past the repaired segment, and into the basilar artery. Both visual cortices received blood. The brainstem branches remained open. For the first time since Cole entered the hospital, the source of the strokes was no longer free to send clots into his brain. Keller withdrew the devices slowly. The repair is stable. The team began preparing Cole for transfer to the neuro-ICU. The procedure had ended, but no one called it a victory. His right side remained weak. His vision remained absent. Small strokes were already visible in both occipital lobes, and no scan could yet show how much threatened tissue would recover. Cole's eyes closed during transport. Leah walked beside him until Amara stopped her at the ICU doors. "He needs deeper sedation for several hours," Amara said. "His artery has been manipulated, and we need his pressure controlled." Leah looked at Cole. "He asked to be told." Amara nodded and touched his shoulder only after Leah announced it. "Cole, we are giving you medicine so your brain and artery can rest. You will have a breathing tube temporarily because your swallowing and breathing became weak during the procedure. Leah will explain it before we begin." Leah moved near his left ear. They restored the blood flow and repaired the injured artery. "Your right side has not returned yet. Your vision has not returned yet. You will be asleep while they protect your breathing." His left hand moved beneath the blanket. Leah placed her fingers inside it. "Will you be here?" he asked. "When you wake up." "Say it again." "I will be here when you wake up." His grip relaxed. The medication entered his IV. Hours passed beneath the blue light of the neuro-ICU. Leah remained in a chair near the bed while the ventilator breathed for him. Brooks sat across the room for part of the night. Weller came twice, first to review the scans and later to stand silently at the foot of the bed. Paige Warren brought coffee. Leah did not drink. "I reported Tyler's recording," Paige said. "And my own comment." Leah looked up. "Your comment?" "Giving Cole to you as a joke. The department heard it. I want it documented anyway. That will not change what happened." "No, but pretending it was harmless would repeat it." Leah nodded once. Paige looked at Cole. "Do you think he will see again?" "I think parts of his visual cortex were injured. Other parts may have been starved but not destroyed. That means maybe. It means we wait." By morning, the follow-up MRI showed no large brainstem infarction. There were new small areas of injury, but the catastrophic stroke they feared had not occurred. The right-sided weakness began to improve before sedation was fully stopped. Cole moved his fingers, then his foot. The breathing tube was removed shortly after noon. His first breath on his own was rough. His first word was not Leah's name. "Light." She stood beside the bed. "You see light?" "Above me." A wide ceiling panel shone directly over him. "Can you see my hand?" Leah moved it slowly between his eyes and the light. Cole's gaze shifted. Something crossed. Amara entered and tested each visual field. Cole detected movement in the center, but missed it almost everywhere else. He could distinguish brightness from darkness and locate the window, but faces remained absent. The recovery was incomplete. It was also real. Amara asked him to lift his right arm. It rose several inches from the bed. Cole listened to the sound of Leah stepping closer. "Still there?" he asked. "Yes." "For how long?" "As long as I'm your doctor." He turned toward the shape he could not yet recognize. "And when I can see you?" Leah paused. Cole's mouth formed the faintest smile. "Will you keep talking then?" Cole's question remained in the room after the monitors returned to their steady rhythm. Leah stood beside his bed, close enough that he could locate her by sound and by the blurred shape moving against the light from the window. "Yes," she said. "I will keep talking." Recovery did not arrive as a single moment. It came in fragments so small that the hospital staff learned not to celebrate them too loudly. On the third day, Cole distinguished the window from the wall. On the fifth, he correctly identified when Leah raised her hand in front of the ceiling light. A week later, he detected movement near the center of his vision, but could not tell whether the moving shape belonged to a person or a machine. The right side of his body recovered faster. His fingers regained strength first, followed by his wrist and elbow. His leg remained unreliable, especially when he was tired. Physical therapists began with simple movements in bed, before progressing to standing exercises between parallel bars. His vision was less predictable. Some mornings, the center of the room appeared as a pale circle surrounded by darkness. On others, the circle narrowed until he could see only light without form. Faces remained impossible. Human features merged into shifting shadows. Amara Singh warned him that the damaged areas of his visual cortex would not regenerate like skin after a cut. The brain can sometimes learn to use surviving pathways more effectively, she explained. But I cannot promise normal vision. Cole sat in his wheelchair with his hands resting on the armrests. How much can I get back? We measure what you have, train what remains, and adapt to what does not return. That was not a number. No, Amara said, because giving you one would be dishonest. Cole turned toward Leah. You trained her. Amara almost smiled. She arrived that way. Visual rehabilitation began with high-contrast shapes placed against bright backgrounds. Cole learned to scan from side to side because his peripheral vision remained severely limited. He practiced finding doors, identifying obstacles and following movement without turning his entire body too quickly. Leah attended whenever her schedule allowed. She never approached silently. 3 steps to your left, she would say. Chair behind your right knee. Table at waist height. At first, Cole continued to follow only her instructions. Then she began making other therapists use the same clear system. Do not make him depend on my voice, she told them. Make the whole hospital worth trusting. Within a month, Cole could walk short distances using a cane and a therapist's guidance. His right leg still dragged when he became tired, but the paralysis everyone feared had not taken hold. He could recognize large objects, detect movement, and occasionally distinguish strong colors under controlled lighting. Faces remained shadows. Conrad Weller visited during one visual field assessment. He waited until the therapist finished before stepping closer. Chief Maddox, may I speak with you? Cole faced the sound. You are already speaking. Weller accepted the correction. I reviewed every record from the day of your injury. And? The first ophthalmologist wrote that traumatic optic neuropathy was possible. The next report described it as probable. By the time you reached rehabilitation, the diagnosis was documented as confirmed. No one confirmed it. No, they copied each other. Yes. Weller's voice carried none of the authority he had used in the emergency department. I accepted a conclusion because several respected physicians had already accepted it. Then I interpreted your anger as evidence that you could not accept your condition. Cole remained silent. Weller continued. You were angry because people touched you without warning, ignored new symptoms, and prepared to send you away. I can be angry for more than one reason. You can. Do you want forgiveness? No. I wanted you to hear me admit that the failure was not your refusal to cooperate. It was ours. Cole turned toward Leah's shape. He practiced that. Weller let out a quiet breath, several times. Keep practicing. The hospital investigation lasted 4 months. It reviewed the missed episodes of weakness, the delayed vascular imaging, the unauthorized recording, and the decision to describe Cole as aggressive without documenting what had happened before each reaction. The changes were not named after him. Cole refused that. Instead, the hospital introduced a sudden vision loss protocol requiring neurovascular evaluation when the eyes appeared too preserved to explain the symptoms. Staff were required to announce themselves and obtain permission before touching blind or visually impaired patients unless immediate danger made that impossible. Symptoms attributed to PTSD had to be reconsidered when new neurological signs appeared. Recording patients without consent became grounds for immediate disciplinary action. Tyler Beck, the resident who had prepared his phone, was removed from clinical work for several weeks. When he returned, he participated in the first training session. Leah stood at the front of the room while he explained what he had done. I thought I was recording a difficult patient humiliating a new doctor, Tyler said. What I was actually recording was a hospital humiliating a blind man while he was having strokes. No one laughed. Paige Warren apologized to Cole privately. She entered the rehabilitation room and announced herself from the doorway. Chief Maddox, it is Dr. Warren. I am 6 feet in front of you. Cole turned toward her voice. Better start. I assigned you to Leah because I expected you to frighten her. I remember. I treated your condition like entertainment. Then I used your reaction to justify what I already believed about you. Cole rested both hands on the parallel bars. Why are you telling me? Because the apology should cost me more than silence. He considered that. I do not forgive quickly, he said. I did not expect you to. But you can stay and watch the session. Paige stood near the wall, while Cole completed 12 careful steps between the bars. 6 months after the procedure, Captain Elena Brooks returned carrying a small black case. She found Leah in the new diagnostic consultation unit that Weller had asked her to lead. The unit accepted patients whose symptoms had been dismissed as psychological, inconsistent, or impossible. Leah had refused to name it North Star. Brooks placed the case on her desk. Inside was an old aviation headset with scratches along one side and a faded white star painted near the microphone. Leah touched it carefully. I thought this was destroyed. It was recovered from storage. I am not returning to operational service. I know. Brooks handed her a training proposal. Naval evacuation teams wanted Leah to teach communication during low-visibility rescues and mass casualty extractions. No deployment requirement, Brooks said. You train the voices that guide people home. Leah looked at the headset. For years, it had represented the night she believed she had failed. Now it carried Aaron Pike's final message and the 6 lives that had crossed the mountain because she chose a route. She signed the proposal. Cole's first clear recognition of her happened during an ordinary appointment. He sat near the window while Leah adjusted a visual chart. The afternoon sun created a bright edge around her head and shoulders. Move closer, he said. She stepped forward. Stop. His eyes searched slowly, using the small area of central vision that had returned in his left eye. Leah waited without speaking. Cole studied the outline of her face. He could not see every feature. Her right side disappeared whenever he looked directly at it, and shadows interrupted the image. But for the first time, her eyes, nose, and mouth existed as parts of the same person. You have dark hair, he said. You sound disappointed. I expected gray. I am 33. You worried like you were 70. He raised his right hand toward his forehead. The salute was slower than the one in Trauma 4, but no less precise. Leah caught his wrist gently before his fingers reached his temple. You do not have to salute me. The first time I saluted the voice. His eyes remained fixed on the partial image of her face. This time, I can almost see the woman. Leah lowered his hand, but did not release it. Months later, a new patient arrived at the emergency department. He was a retired helicopter crew chief who insisted that sections of the world disappeared for several seconds whenever he turned his head. His eye examination had been normal. His previous hospital had diagnosed anxiety. No one laughed. No one prepared a psychiatric transfer. The nurse announced every movement before touching him, documented the position that triggered the symptoms, and called the diagnostic consultation unit. Leah arrived carrying a medical bag with the faded North Star patch secured inside. Cole had survived the dark by following her voice. When the light finally returned, North Star was still there.